We'd like to welcome to the stage Dr. Hugh Foy, who's a national board member with Physicians for a National Health Program. Here you go, Foy. Let's hear it.
Thanks, John. Thanks, everyone, for coming out. Right? 80% of life is showing up, and here we are. Not only are we showing up, but we're all together. And one thing they'll try to do is divide us. But we need to have a uniform group of people focused on universal health care for all.
Speak to the
Yes.
mic.
Speak to the mic.
Okay, right there.
Better.
Good,
Belt
good.
it out.
Physicians for National Health Program is not just physicians, but it's over 30 years old. It's more than 20,000 people strong from all walks of life, not just physicians. And it sprang out of the Medical Committee for Human Rights in the Civil Rights Movement in the 60s. So we've worked hard to primarily educate people about the value of universal health care, and currently our main focus is to help stop the privatization of what we already fought so hard for 50 years ago. Right? Medicare was designed to help prevent our elder people, excuse me, somewhere this day thing is going on. It's going off in my head with my senior earbuds, excuse me. It was to help prevent people not dying in poverty just because they were elderly or infirm. And we see that all the time. I'm a retired general surgeon and intensivist, and I worked in what was left of the public sector in a couple of Seattle hospitals my entire 45-year career, mostly teaching younger people how to take care of people. And time after time, we see that taken away from us by over-corporatization of healthcare. And the biggest evil right now is Medicare Advantage, which we all know is not Medicare. No, it's for-profit HMOs, which are immoral. Okay, they are immoral. So it's not Medicare, and it's not an advantage. Well, it is to some people, just to the corporations and their stockholders that have it. All right? So we don't need Medicare Advantage. We don't need ACO REACH, just like we no longer need whalers or buffalo hunters, right? They extinguished their prey, and we can't let health insurance executives and large corporate takeovers extinguish us in our need for health care. I spend at least 2 hours a day helping people navigate, and I won't say system because it's not a system. It's chaos, and it's the last gold rush left on the planet, at least in our country. Why else would international venture capitalists want to take over practices of medicine and large corporate health insurers? People don't know where to go. They don't know who to call. They don't know how to access care. And a lot of these people are fortunate, like myself, to have and be able to afford top shelf level health insurance, right? Not to mention the poor. So time after time I help people navigate this chaos, and I need to enlist your support to help push our politicians to do the right thing. We can vote, right? People voted all over the country yesterday, but you know how else we vote is by calling them, by writing them, right? And you only need to know one thing nationally, and that's 202, right? What's 202? Washington, D.C.'s area code. You call 202-555-1212 and say, I want to talk to Adam Smith, or I want to talk to Patty Murray's office, and we keep the pressure on to get universal health care for all, right? That's our short-range goal. We need a medium-range goal, is to have the control of the corporations. We need to get rid of Citizens United. And so that the legalization of government bribery. And lastly, it doesn't help if you have top shelf insurance. If you call and they say, oh, sure, we're happy to see you. How does 3 months from now work? it doesn't work, right?
That's right.
So we need long-range planning and scholarships for young people to enter the healthcare workforce in exchange for loan forgiveness, right?
Yep.
People walking out of medical school right now have almost $300,000 in debt
That ain't right.
just to get through that. So we need long-range planning, we need scholarships, and we need loan forgiveness as an alternative to just the military, which it is right now. So short-range goals, medium-range goals, and over the horizon, we need long-range goals. So thanks for showing up.
Thank you.
Everybody in?
Nobody out!
Everybody in?
Nobody out!
Everybody in?
Nobody out!
Thanks a lot for coming.
One more time for Dr. Foy.